This guide is to help explain your occupational health report. The report will always contain information about the background to the case and what was discussed during the consultation. Although you may know the history, we do still have to include it to show we've conducted a fair assessment. Sometimes, an employee may make allegations to the clinician, which we have to include in the report. We may say something like, "The employee perceives that," "The employee alleges that," or "The employee tells me that." This is not saying what we've been told is factually true. It's just what they've said to us. If you don't agree with what the employee has said, you should investigate it further with the employee, following your own disciplinary or grievance policies, whilst always making sure you follow the ACAS code. Whether or not an employee is disabled is ultimately only ever a legal decision, although if we say the employee is likely to be covered by the Equality Act, that means you should probably treat the employee as if they are disabled. The Act does not say you cannot dismiss an employee with a disability. It says you must do all you reasonably can to accommodate the condition before taking the capability pathway. If a report says you should consider making an adjustment, it does not mean you have to make the adjustment. You should document your decision-making process whilst considering the adjustment, especially if you decide not to follow the suggestion.
The report contains special category data, so you must store and process it carefully. It should only ever be shared with those who need access to the information in order to support the employee, and it should never be shared widely amongst a team. Employee health data, including sickness absence records and occupational health reports, should always be held in a secure way with access controls. It's important to say that the opinions and advice contained in an occupational health report are just that, opinions and advice. The business must choose what to do with the advice the report contains, which usually means using it as a basis for making reasonable decisions. No occupational health clinician will ever say, "And now you should dismiss," or "You must let them work part-time." Rather, a report may say, "They are unlikely to be fit to work in the next 3 months," or "The business could consider an alternative part-time role." The report will only ever advise and inform, and it is always up to the business to make management decisions. It's also good practice to act upon medical advice as soon as it is received. Court decisions have shown that employers must use medical advice within a reasonable time, within 12 weeks. This means you should always act upon a report as soon as it arrives. If you delay for 4 or 5 months and then move to dismiss, using the report as a justification, it will be automatically unfair.
If you are unsure what the advice in an occupational health report means, or feel that we haven't answered a question, we're pleased to provide clarifications as part of our service. We do need to ask for requests be made in writing, so that accurate records of any conversations can be retained. The clinician can only comment on the information already contained in the report. They're unable to share new information or answer new questions based on what's just been learned in the report. If new information needs to be shared, it may be possible to create a report addendum, although the employee's explicit informed consent will be required in order for new information to be shared. If you're not sure about a report or what the advice means, please contact our support team as soon as possible. Please let us know if there's anything else at all we can do to help.